thing working in healthcare has taught me that HIV is not something you should be afraid of. Rather, it's something you should understand. In my workplace, we see and manage people living with HIV, and there are things I wish people knew how transmission happens, how healthcare workers protect themselves, and how you can also protect yourself. I know you all might have questions. Okay, you work in a viral unit, you're exposed to HIV patients, you interact with them. Yes, we do. Because we don't want stigmatization, because they feel like if you look at them psychologically, they're already sick, and they know that people will be looking at them differently. That's why patient confidentiality is very serious in the unit, because you don't expose the patient details outside to anyone. So imagine when you're working there, you cannot look at them anyhow. You have to just interact with them as if they are perfectly okay, nothing is wrong with them. They are human beings like you, just that they have a virus. So that stigmatization is already there. And coupled with the fact that there are a lot of people, societal effects are also about it. So we interact with them normal, there's no discrimination or anything, but that does not mean you should not take precaution or protect yourself. So for me, that is working. Then I come with my children, my family. Yes, might have a question. How is she handling all this so well? It's not really easy, I must say, because there are also opportunity infections, which I didn't talk about. Opportunity infection, there's a lot of things that goes around which they easily contact it because their immunity is low. Can be all this flu, cough, TB. So all these things. So I'm very, very certain that we try our best to protect ourselves. And I always try my best because I have children and I won't want to catch a little infection or something elsewhere and come on and transfer it to my kids. So all those things is just what work hazard is all about. But still we take our measures to prevent all these things from happening. But anyway, I feel that working in this unit, it gives me, or it opens my eyes more to things that we all should know about. Yes, it's something we are afraid of, we don't want to get it, but that does not mean that we should not know how to prevent it or what to do when you see it or when you are exposed to it. So people should just be aware of the environment. Don't assume anybody's health status. Get tested. If you have a partner, don't just assume, oh, this person, it doesn't show on the face. It's not written on the face. It's not written on the forehead. So don't assume. Get tested and be certain. That's how it is. So everybody just have a life to live. So you just decide how you want to live your life. Nobody judges you. It's just your personal decision. But whatever you do, please be careful out there. That's all I have to say. So for those that don't know me, that have seen my channel for the first time or view my video for the first time, I'm a pharmacist and I work in a hospital. And I want to take you through a little bit of what my work is all about. I work in a hospital in an antiretroviral unit whereby we treat HIV patients. When we come to HIV, you all know that HIV is a popular virus infection that everybody knows about. But then the awareness is kind of reducing as of recent. So I felt like, okay, why not I use my space to still talk about it? But this is what my work is. So if you want to know me, following my growth in this space, you should also know what I do for living. And so instead of me just talking about it out there, I also want to talk to my viewers on YouTube about it and what it's all about. So in case you're not enlightened or you don't know what it's all about, HIV is a viral infection which affects the immune system. It attacks your immunity and reduces it to the barest minimum that you won't be able to fight any opportunities infection that comes or throws at you or you come across on your way or anywhere. It just reduces your immunity. That's the place it attacks. So when it comes to HIV in the hospital, we have a lot of patients we see on daily basis. We meet a lot of people, and both old, young, babies, pregnant mothers. So we have a different categories of medications we give. So in my unit as a pharmacist, I have a lot of drugs available that I can enlighten people about it, or even tell people that, okay, if you are, okay, let's go this way. There are three categories of drugs we can give regarding HIV infection as a whole. First is the PrEP. PrEP has to do with if you are going to be exposed or you have tendency to be exposed, probably you're working it or you feel that probably your partner is positive and you are not, so and you might want to have intercourse with your partner. So in order to protect yourself from getting the virus, we have drugs for it. That is PrEP. pre-exposure prophylaxis, so to prevent or protect you from being infected with the virus. So in terms of giving this, we have the orals and we have the injection. So just based on you, what works for you and what you feel like you want to. But the injection is once in 2 months. Come on. So if you have something to protect yourself like this, why would you want to be exposed or put yourself in a condition whereby that you will be infected with the virus? And it's a lifelong treatment. The moment you are positive, you have to be on medication on a daily basis to the end of life. So there's no cure for HIV. Then when it comes to the second category of the drug, which is PEP. PEP has to do with post-exposure prophylaxis. Post-exposure prophylaxis means that I'm already exposed. What can I do to protect myself or prevent or fight the infection so I won't be infected? So that's what PEP is all about. So when you're already exposed, we still have medications that you can take to protect you from coming down with the virus or being infected with the virus. But then it has a window period of 72 hours. That's 3 days of exposure. So the moment you're already exposed, you have 3 days to report yourself to any nearest clinic and be able to be tested and given medication immediately. So when that window period is over and you have not started taking any medication, there's high possibility that you'll be infected if your means of exposure was, or you're certain that the person you were exposed to is already carrying the virus or the person is positive. So these are categories of drugs we can give you. Then if you're already infected with the virus, we also have drugs for you for management, which you take on a daily basis. And it's normally taken at a particular time over throughout your lifetime. So with this, I feel like a lot of persons don't really know or are not enlightened that, because there's always new enrollees on daily basis. We have new patients being enrolled to the program on daily basis. So make me wonder, is that people are not enlightened about the dangers of having unprotected sexual intercourse with unknown person or even your partner that you don't know their health status and you are not protecting yourself. Okay, a lot of persons might come in that they want to take the PrEP, pre-exposure prophylaxis, before being exposed because they know the kind of lifestyle they live. Yes, we encourage people also to protect themselves. We can't change your lifestyle, but we encourage you to take precaution so I won't be infected and also transmit the infection to other persons. Because in that way, it will be curtailed. But with the rate I'm seeing, because currently, I don't know, the rate is increasing on daily basis. Most times you can have 5 new patients in a day being enrolled in the program. So that means it's not being curtailed, it's still spreading. So I feel, okay, this is what I do and this is my work. And I also want to share it and I make more like an awareness that this is me and people should please take their life serious. So if you feel like you don't really understand or you have questions, you can actually ask me. I'm open to answer your questions, but then I don't want it to be affected wrongly or by mistake, because majority of these new enrollees are by mistake. They are not aware that you're supposed to be protect yourself with a protective gear, or you're supposed to prevent body fluid from touching you when you're having interaction with someone that you don't know their health status, or when you're eventually exposed. There's medication you can take medication to fight off the virus. So it's not like an avenue for me to talk to you guys about what I do. And if you have not subscribed to my YouTube channel, please do subscribe. I'm a part of my community. Remember to like this video and please share for people you might feel that they will need it. And if you have any questions, feel free to ask me. I'm always open to talk about it. Thanks for watching my videos. See you in my next one. Bye.